Hi friends, this is Dr. Shashikanth, consultant orthopedic and joint replacement surgeon. Today we'll discuss about robotic TKR. The most common question or confusion people have is whether to get robotic TKR or not. Robotic TKR is the most advanced technology, but in total knee replacement, the most important factor deciding the outcome is alignment of the leg and stability. Robotic TKR is more precise and more successful in achieving both of them. But what about the other factors like pain, blood loss, duration of surgery, and long term outcome? Coming to pain, patient usually experience less pain in the immediate post surgery period following robotic TKR as we release less soft tissues like muscles and ligaments during surgery. Then coming to blood loss, patient usually will have less blood loss with robotic TKR as the bone cuts and soft tissue releases are less compared to conventional TKR. Duration of surgery is almost same or there is no difference in duration of surgery between robotic TKR and conventional TKR. Coming to long-term outcome, as of now, there is no difference in the long-term outcome between robotic TKR and conventional TKR. To conclude, patient will usually experience less pain and less blood loss with robotic TKR. And if you have access to robotic TKR, you can use the technology. Thank you.